PG Doctors, INDRANJU.
Hi doctor friends, welcome to my YouTube channel PG Doctors INDRANJU. Our topic is 50 most important blood related MCQ for NEET PG, PGI, FMGI, FMGE and other medical PG exam. I will discuss on each question respectively, and any queries regarding this video please write in my comments box, and each question I will try to describe, but all things related blood I will upload that topic on the next video. So let us start with the first question. Is the erythropoiesis in gestational takes place in the option given is yolk sac, amniotic sac, placenta and the chorion. The answer is the yolk sac. The erythropoiesis. The erythropoiesis related question you can solve easily by this type. The intrauterine life. In the intrauterine life, the 0 to 10 week of life, the erythropoietic organ is the yolk sac. And 10 week to 5 month, it is mainly liver, then after mainly, and that of the spleen. The option if given is liver, spleen and other, then you have to choose liver is the most important in the erythropoiesis. The age will be 10 week to 5 month, and after 5 month onward, this is the bone marrow. This is bone marrow, and after a birth up to 20 week, up to 20 year, it will be bone marrow of all bone, while that the after 20 year, this will be flat bone, and flat bone of the axial skeleton and the proximal part of the femur and humerus. The answer will be the spleen and the liver. This is the 3rd and 4th month. I have already told regarding this erythropoiesis. So spleen and liver, and most common if asked, then it is only liver. If PGI will ask this question, then you have to choose both option, and if in the NEET PG, FMGE, then only you have to choose liver. Next question. In erythropoiesis, the size of cell increase in the subsequent stages, and hemoglobin appears at early normoblast stage. Mitosis occurs in the late normoblast at the fastest rate, and folic acid use full as a maturation factor. The answer for such will be the folic acid is useful as the maturation factor, due to in the erythropoiesis process, the size of the cell get decreased and hemoglobin appear at the early normoblast. This is wrong, already told in the previous question. It is the intermediate normoblast, and the mitosis occurs in the late normoblast. This is also Not right, it is in intermediate neuroblast. Next question, the chemical structure of hemoglobin is has two polypeptide chain with 4 heme and has 4 polypeptide chain with 2 heme and 4 polypeptide chain with 2 heme, sorry, 4 heme, and none of the above. The right option will be the 4 polypeptide chain with 4 heme group. First of all, you have to know that the hemoglobin is made up of the heme group plus globin. That means one is the proteinous part and the another one is the non-proteinous part. And globin is made up of the 4 polypeptide chain, while that of heme molecule is here, it is 4 in number. So the 4 polypeptide chain with 4 heme is the right answer. Next question is the site of RBC formation in 20-year-old healthy male. Already told that the site of RBC formation after the 20-year-old healthy male will be the flat bone of the axial skeleton. Next question is the type of hemoglobin that has least affinity for 2,3 bisphosphoglycerate. The option is HbA1, HbF, none, and HbA2. That here the question asking about the least affinity. The 2,3 BPG have the affinity with the adult hemoglobin, not with the fetal hemoglobin. So it has least affinity. Next, the second most common hemoglobin in the adult. The option given alpha 2 beta 2, alpha 2 gamma 2, alpha 2 delta 2, and beta 2 gamma 2. You already know that hemoglobin is made up of the two pair of the polypeptide chain and the 4 heme molecule. But here the 2 polypeptide chain is alpha and beta. That means alpha 2 and the beta 2. Alpha 2 beta 2 is the most common finding of the adult hemoglobin. That means this indicate adult hemoglobin. HbA, this is the most common type. And alpha chain contains, many times asked in the PG question, that how many amino acids are found in the alpha chain and the beta chain. In the alpha chain 141 amino acids are found, and in the beta chain there are 146 amino acids are found. Apart from this, this is the hemoglobin A, or you may write this as HbA1 and HbA2. These are made up of the alpha 2 and the delta 2. This found average and approximately to 3% of the whole adult hemoglobin, and major part and most common part is the A1, and alpha 2 and delta 2 represents the A2, and this is the least form of the hemoglobin in the adult. If we told about the hemoglobin of fetus. This will be the alpha 2 and the gamma 2. These are found in the fetal hemoglobin. Then the right answer to that will be alpha 2 delta 2. Next question is fetal hemoglobin. Fetal hemoglobin contains alpha 2 beta 2 alpha 2 gamma 2 alpha 2 delta 2 and now already told in the previous question this will be the alpha 2 and gamma 2. Next question is the ADT test for. What is the ADT test? This is the alkaline denaturation test. This test is done for especially for the fetal hemoglobin, due to fetal hemoglobin is resistant to the alkaline denaturation. So all are sensitive, but fetal hemoglobin are resistant. So alkaline denaturation test have performed for the fetal hemoglobin. And the next question, the lysozyme are found in the option given the eukaryotes, proteus, virus and prokaryotes. You already know about the lysozymes. Lysozymes are the membrane bound structure and these are found only in the eukaryotes, not in the prokaryotes, not in the virus. So right answer will be prokaryotes. Next question, about the von Willebrand factor is synthesized by all except. The option is endothelial cell, megakaryocytes, hepatocytes and none. Already you have to know that the von Willebrand factor is synthesized in endothelial cell and megakaryocytes, not in the hepatocytes. So right answer will be hepatocytes. Next question is vitamin K is involved in the action of the following protein except. The option being given the factor 2, factor 10, factor first and protein C. The question is asking about the protein. Okay, and main trick about that, the vitamin K involve the action of the factor. If you can remember, this will be 2, 7, 9 and 10 along with the protein C and S. This is the main finding of that question. So you have to remember vitamin K action along with the factor 2, 7, 9, 10 and the protein C and S. Here the following protein option given factor 2, that means factor 2 you can know, factor 10, factor first and here the protein C is given. So the option will be here. Next question is the all are vitamin K dependent clotting factor except clotting factor except you already know 2, 10, 9. Here the question is asking about the clotting factor, and a previous question that was the protein, asking about the protein. So don't be confused here, only you have to know about that the clotting factor. So here the protein C, this is a protein, not a clotting factor, so answer will be the protein C. Next question is, which is the vitamin K dependent clotting factor? You already know 2, 7, 9 and the 10. The option given here, the 7, this will be the right answer. Next, similar question, the vitamin K dependent coagulation factor includes the 2, 3, no, 9, 10, yes, 3 and 5, no, 8 and 12, no. So right answer will be 9 and 10. Same type of the question many times asking in the PG exam. The all are the vitamin K dependent clotting factor of the hepatic origin except the first you have to remember 2, 7, 9 and 10. Sorry, 10. Here the 2 given, 7 given, 10 given, but here this is the 8. So you can choose right answer. Next, same type of the question, not a vitamin K dependent factor. This is dependent, this is dependent, this is dependent, this is not a dependent factor 12. So right answer will be not. So this is the right answer. Next question, Decamerol is a drug that impairs the utilization of the vitamin K by the liver. Decamerol therapy therefore would decrease the plasma concentration of the which of the following procoagulant? The option given, the prothrombin, fibrinogen, anti-hemophilic factor and AC globulin. The right answer for such is the prothrombin. Due to prothrombin, first of all I have to revise you the name of the clotting factor, so you will not be confused in the any type of the PG exam. Start with the factor. The first factor is the fibrinogen, is the first factor. Then second factor is the prothrombin. Third factor is the thromboplastin. Fourth factor is the calcium. Fifth factor is the proaxalerin and Levile factor 6, and this is the proconvertin. This is the seventh clotting factor, and this is the eighth clotting factor, anti-hemophilic factor A, and next ninth factor is the anti-hemophilic factor B. This is wrong. Stewart power factor, this is factor 10th, and anti-hemophilic factor C, it is the 11th factor, and this is also called as the plasma thromboplastin antecedent, and next to that is Heisman factor and glass contact factor, it is 12, and 13 is the Lucky Laurent factor. This is also known as the fibrin stabilizing factor. This all thing, that means all 30 factor are important for your PG exam, that individual factor have been many times asked. So you have to remember 1, 2, 3, 4, 5, 6. Sorry. Sorry, 6 factor is not found. This is the pro-converting 7, 8, 9, 10, 11, 12 and 13. So the prothrombin is the second factor and fibrinogen is the first factor. Anti-hemophilic factor, you may ask, this is 8, and anticoagulant globin. So here the question arising that the consent is which of the following procoagulant. This is the right answer, prothrombin. Next question is the which of the following is not involved in the intrinsic pathway. So first you have to know about the what is the which factor included in the intrinsic pathway and extrinsic pathway. The first of all, the option is given the 12, 11, 9th and the 7th. The right answer is the 7th, which are the included in the intrinsic, sorry, not involved in the intrinsic pathway, and it is in the extrinsic pathway. The description for such is the, you can see the extrinsic system and the intrinsic system. The extrinsic system start with the 7th clotting factor, which becomes activated in the presence of the 12th activated and the 11th activated and the callicarine, and then this becomes activate the 10th clotting factor to 10th active form, and in presence of 10 active form and calcium and along with the factor 5, this converts the prothrombin to the thrombin, which are the common pathway. This below, that is the common pathway, and this thrombin convert the fibrinogen to the fibrin, which are soluble in the form, and this convert fibrin to fibrin insoluble form in the presence of thrombin and the fibrin stabilizing factor, that means 13. And in the intrinsic pathway, the 12th activated form, which are activated by the contact, and it becomes activates the 11th clotting factor to active form of the 11th clotting factor in the presence with this converts takes place in the presence of the HMW kineson, and the 11th activated form in presence of the calcium, this activate 9th clotting factor to 9th active form, and this 9 active form along with the factor 8 and calcium, this activate 10th clotting factor to 10th active form. This is the intrinsic system and the extrinsic system. The question, you can understand the question, what is asking about the question. So the 7th are included in the extrinsic system, not in the intrinsic system. So you will appreciate that what is the intrinsic system and what is the extrinsic system. Next question, and so the right answer will be the 7th, which are included in the extrinsic pathway. Next question is the site of RBC formation. Again asking question, the 20-year-old healthy male, this is the flat one. Next question is the conversion of fibrinogen to the fibrin is by. The question focusing about the conversion of fibrinogen to the fibrin is by factor 13, kallikrein, prothrombin and the thrombin. The first you have to remember that the thrombin is the main part for the fibrinogen to fibrin formation, and the factor 13, that means fibrin stabilizing factor, is responsible for the soluble form of the fibrin to the insoluble form conversion. So right answer will be thrombin. Next question, so that is the which of the following help in the bridging the fibrin. Question is the bridging the fibrin in the clot and stabilize the clot. The factor 13. And next question is asking about the half-life of the factor 8. The option being given the 8 to 12, 16 days to 4 hours and 6 minutes. The right answer is 8 to 12 hours. This is question, you have to retain it. All the endothelial cells produce thrombomodulin except those found in the option being given the hepatic circulation, cutaneous circulation, cerebral microcirculation and the renal circulation. This is the only the online question, so you have to remember by the repeated retaining and the pronunciation that this is the cerebral microcirculation, which are no found in such that. So the right option will be the cerebral microcirculation. The next question about the blood in the vessels normally does not clot because the vitamin K antagonists are present in the plasma. Thrombin has the positive feedback on the plasminogen. Sodium citrate in the plasma chelate the calcium ion, and the vascular endothelium is the smooth and the coated with the glycocalyx. So the right answer will be the vascular endothelium is smooth and coated with the glycocalyx. Next question is the thrombin activity is inhibited by. The option is given the chymotrypsin, heparin, cofactor second, alpha 2 antitrypsin and alpha 2 macroglobulin. This question focusing about where the naturally occurring thrombin inhibitor in the normal plasma level. So the first of all you have to remember that the alpha 2 anticoagulant, these are the inhibitor, thrombin activity inhibitor. Heparin cofactor second, this is also thrombin inhibitor. The most important is the antithrombin 3, which is the most important and contribution approx to 80% of the antithrombin activity, and it inhibits the factor 9A and the 10A. So the intrinsic activity get hampered, and apart from that this also inhibit the factor 11, factor 12, that means all active form. I'm asking about the all active form, and also in the extrinsic pathway is factor 7 active form, and this is the most important. And after that is the, if you give the number, this is the first number, second number, and that is third number, the happening correlative factor. So the right option, if you have to choose, then this will be the suggestion. So next question, during hemostasis, platelet affect the coagulation area except the platelet adhesion to exposed endothelium, clot retraction, activation of prothrombinase complex, and vasodilation. The question is asking about the homeostasis. In the homeostasis, the first, the platelet adhesion to the exposed endothelium takes place already. So this is the right answer. And the clot retraction takes place. After the clot formation, if the size of the clot formation is like that, then after processing, the size of clot becomes decreased. That means it is completely arranged. This is called the clot retraction. So this will occurs. And activation of prothrombinase complex are formed. This is also right answer, but never the vasodilation. After that, the processing, the vasoconstriction takes place, not vasodilation takes place, so that the clot are removed from such site. Okay, so the right answer will be vaso. The next question is conversion of prothrombin to thrombin requires calcium 5 10th and calcium 5 and calcium 10th 5 12th and calcium. You have already know the conversion of the prothrombin to thrombin requires only factor 5 and factor 10. Along with that, the metallic ion is the calcium. So the right answer will be 5 and the 5 10 and the calcium. Next question is asking about the thrombomodulin thrombin complex prevent the clotting because thrombomodulin inhibit the prothrombin activation. Thrombomodulin thrombin complex complex activates the antithrombin 3. The binding of the thrombomodulin with thrombin remove thrombin and also activates the plasma protein C, which activated factor 5 and 8, and the thrombomodulin thrombin complex activates the heparin. The right answer is C. Due to thrombomodulin and thrombin complex first remove the thrombin, after that it activates the plasma protein C, and by the help of the plasma protein S, this inactivate the factor 5 and factor 8. So right answer will be C. Next, protein C activation causes. The protein C activation causes promotion of clotting factor, inactivation of the factor 2, activation of factor 10, and inactivation of the factor 5. From the previous question, same type of the question is asking, so the right answer will be the inactivation of the factor 5. Next question is the thromboxane A2 is produced mainly by vascular endothelium, platelet, liver, and the damaged tissue. Now, the Platelet is the responsible for the secretion of the thromboxane A2, which are the vasoconstrictor. Okay, and the prostaglandin I2 is responsible for the vasodilation. But in the hemostasis of after the clot formation, there is the processing of the clot retraction, and after that the thromboxane A2 are released, and which causes the vasoconstriction. Next question, which one of the following is released by the blood platelet during the hemorrhage to produce vasoconstriction? In that question, vasoconstriction is asking serotonin, histamine, bradykinin, and thrombostatin. In all the following are vasodilator. Apart from that, only serotonin are the vasoconstrictor. So right option will be the serotonin. Next question is the substance that is present in both serum and the plasma. The serum and plasma. In the question asking about the both serum and the plasma. First of all, what is the plasma? Plasma is equal to blood minus cellular element, while that of the serum is equal to the plasma minus clotting factor or the coagulation protein. That means in that the coagulation protein. So you already know about the serum. What is the difference between the serum and the plasma? And this question is directly asking about the extrinsic pathway. So the right option for such is the factor 7. That means which are present in the extrinsic pathway or both serum and the plasma. Next is the heme is converted to bilirubin mainly. What is the liver, kidney, spleen, and bone marrow? First of all, you have to know that the breakdown of heme, that means the hemolysis mainly takes place in the spleen, after that in the liver. So right option will be the spleen. The metalloprotein help in the jaundice by the following mechanism: increase glucuronide transferase activity, inhibit the hemoxygenase activity, decrease RBC lysis, and increase Y and Z receptor. But the right option is the inhibit hemoxygenase. Okay. Next question is what is true of the iron? It is stored in the ferritin. It is absorbed by the transferrin in the intestine, and spleen is the major storage organ, and Fe2 plus is excreted in the urine. In that question, the iron is stored in the ferritin form. This is 100% right. It is absorbed by transfer. What is wrong? The absorbed by the intestine by ferritin and other divalent channel, not by the transferrin. This is a transporter protein. Okay, and spleen is the major storage organ. The spleen, liver, and the bone marrow is stored in the form of what? Hemosiderin. Okay, so the right option will be stored in ferritin form. Next question is asking about the which one of the following protein inhibit the heme loss from the plasma. Then the heme loss, that means only heme are not exist and it are excreted, and something missing in the previous question, that the Fe2 plus are excreted in the urine. This is wrong due to the iron is excreted in the mostly in the feces, so not in the urine. Next question is the following protein inhibit the loss of heme. So the hemopaxin, right answer hemosiderin, wrong. Ferritin, wrong. Transferrin, wrong. The question asking about the protein inhibit heme loss. Heme loss inhibit. How it inhibit? By the hemopaxin and the haptoglobulin, which haptoglobulin and hemopaxin acts as a binding agent to the heme, which can't be lost from the plasma. So the right option will be hemopaxin, and apart from the hemopaxin, if the haptoglobulin are given, then that will be the right answer. The hemoglobin binding protein is the hemopaxin, haptoglobulin, albumin, and the all of the above. The all are the hemoglobin binding protein. So right answer will be all of the above. Next question, the helper and cytotoxic cell belongs to. The helper and cytotoxic cell are belongs to the T cell category, and memory T cell are also the part of such. So I will discuss in the immunity chapter. Next question. The lifespan of the neutrophil is 6 hours, 6 days, 15 days, and the 10 days. The average half-life of the circulating neutrophils is the 6 hour. So right answer will be 6 hour. Next question is the neutrophil secretes superoxide dismutase, myeloperoxidase, lysosomal enzyme, and the catalase. Then you have to know about these are internal and internal, but the secretion is myeloperoxidase is mainly. Okay. Next, the eosinophilic granules contains all of these enzymes except urokinase, elastase, myeloperoxidase, and collagenase. Eosinophilic granules found in the neutrophils. Okay, this is the eosinophilic granules. That means the primary granules found in the neutrophils. These are elastase, myeloperoxidase, and collagenase. So right answer will be urokinase. The absolute monocytosis is seen in the option is given the infectious mononucleosis, Kala-Azar, TB, brucellosis, and all. These are the option given, and in that right answer is all. Next question is the central lymphoid organ are. Option is spleen, thymus, tonsil, and lymph node. The you have already know about the central lymphoid organ is only two, thymus and the bone marrow. These are the house for the lymphocytosis. Next question is GCSF and GMCSF in the hematopoiesis cause leukocytosis, leukopenia, erythrocytopenia, and thrombocytosis. The G indicates granules. So the granulocytes this stimulates G CSF stimulates granulocytes that means neutrophils, eosinophils, and the basophils. And in the GMCSF, M4, this M indicates the monocytic precursor, and GM stimulates all. So leukocytosis will occur. This will be the right answer. Next, erythropoiesis is promoted by all of the following except option given: thyroxine, prolactin, ACTH, and estrogen. The erythropoiesis is promoted by this thyroxine also promote the erythropoiesis, prolactin and ACTH, but these are the estrogen, which is the right answer. Next, the thrombostatin is a thrombosis preventing protein, contractile protein, coagulation protein, and protein for the regulating platelet production. The thrombostatin is a protein which are contractile in the nature. So the answer will be contractile protein. Next, von Willebrand factor is produced by, already told in the previous, thus that the von Willebrand factor is produced by the endothelial cell and megakaryocytes. So right answer will be that. Ceruloplasmin binds. The ceruloplasmin binds with copper. Okay. These are all things regarding this. So thanks for watching my video. Have a nice day, and any queries regarding this video you can write in my comments box, and subscribe my channel. And again, thanks for watching my video. Have a nice day.